Welcome to RN Osce learning sessions. Today we will go through Station 5 Emergency Skills Assessment. This scenario takes places in a public setting, a cafeteria environment. You are a nurse by profession. In the situation, what happened is a middle-aged man collapsed suddenly after clenching his chest, a classic sign of possible cardiac arrest. He is unresponsive, not breathing, and unknown identity and medical history. His background history revealed a witness reported he clenched his fist over his chest before collapsing, a common symptoms in cardiac events. No further medical history, medications, or prior medical conditions were reported. After assessment, you found that the patient is unresponsive, not breathing. Our recommendations and our task, that is, you have to initiate CPR as it is an adult, 30:2 ratio, and you have to give clear instructions to the bystander to activate ERS, emergency response team, by dialing 111, and you are requested to get an AED and asked to assist you. And you have to hand over the person to ambulance personnel by using S-bar tool. Your countdown begins for 8 minutes with a warning bell at 6 minutes. As you all know, it's an emergency skill assessment station. Your performance will be evaluated based on how spontaneously and effectively you respond to emergency scenarios. They will be assess your ability to act promptly and confidently, and also how clearly you are communicating and delegating the task to a bystander or a layperson, and also your overall confidence and competencies in handling such situation appropriately will be assessed in the station. As always, you enter the room and you find yourself in a cafeteria scene that is not entirely safe. While entering the room itself, you can feel that the scene is not safe to approach. You notice a man has collapsed with chairs or any other objects on or around his chest or his shoulders. And your first step is to ensure the scene is safe for yourself and others to approach. So you have to carefully remove any obstructions from the man and make sure that he is in a safe position for assessment. Nearby you can spot a bystander standing in a shock. You approach and ask, do you know who is this person? Can you tell me what happened? So let's start. As always, knock the door. Look for scene safety. Okay, you know that scene is not safe. You have to remove the danger as early as possible, and you have to ask that bystander, what happened to him? Do you know him? Do you have any idea about what happened? He replies, no, I just saw he fell down with placing hands on his chest. Okay, I am so and so. I am a nurse by profession. Don't worry. I know how to handle this situation appropriately. You have to be here. You have to initiate the conversation like this. Am I clear? Okay. In this, your leadership qualities and delegation skills will be evaluated in the station. Remember, while you may seek help from bystanders, your ultimate responsibility, you are the one, you have the ultimate responsibility for this situation. It lies with you only. So you have to keep in mind that your leadership qualities and delegation skill will be evaluated. So the ultimate responsibility for this entire situation lies with us only. Okay. So your assessment begins. You have to ask or you have to check your assessment begins by firmly tapping both shoulders of the individual and asking loudly, are you okay? If there is no response, immediately you have to instruct a bystander to call emergency service and tell them activate 111 and bring an AED without any delay. Okay, so let's start. check the response by tapping the shoulder firmly and asking that, are you okay? Are you okay? If he is not responding, you have to instruct him that, could you please activate 111 and bring AED as early as possible. And you have to keep in mind that if you don't specifically request for an AED, it will not be provided. So what you ask for will be given, and how you instruct will be determined how it is carried out. Okay, so it is essential to practice clear and structured communication. Okay, next begin assessing the airway by using the left hand to tilt the head back and your right hand to lift the chin to open the airway, as we studied it already. And you have to look for any visible foreign body in the mouth or throat. Simultaneously, you have to locate the trachea with 2 or 3 fingers and move slightly to the side into the groove and check for carotid pulse for 10 seconds. Okay, so this is our assessment part. And once you confirm that there are no signs of life, verbalize it clearly. Okay, let's start the chest compression. There are no signs of life. Ensure that after each compression you allow for complete chest recoil. You would be using a feedback mannequin which provides visual indicators of your compression quality. 2 green lights that indicate the compression depth, rate and recoil were maintained. The correct rate of, and once the orange light you can visible, that means you are going too fast. That means above 120 per minute. You are not allowing the heart to refill properly. And if it shows a red light, that also indicates inadequate depth or rate below 100 per minute, which means poor circulation. That also ineffective compression. So always try to practice. While practicing, you have to maintain in a 2 green lights. And continue performing 30 compression followed by 2 rescue breath by using face shield with head tilt and chin lift method. This cycle should be maintained until the AED arrives and it is ready to use. So what you have to do is, you have to verbalize like this way. Place your hands directly over the sternum or over the chest. Elbows should be straight, shoulders should be directly perpendicular to the victim's chest. I am going to push hard and fast, at least 2 inch or 5 centimeter in depth. And I practice to deliver 30 compression and 2 breath ratio. That means 30:2 ratio. And continue your compressions and breath until the AED arrives. Am I clear to you? Okay. Again, once the AED arrives, what will be your expected response means, your first step is to turn on the AED by pressing the power button. You have to say that that bystander will come near to you and he will say that here is your AED. So you have to reply, thank you for your prompt response. Please start giving compression like this way. Then he may say that I don't know how to perform. No worries, I will teach you, follow my instructions. Am I clear to you? Okay. Place your hands like this directly over the chest. Push hard and fast, at least 2 inch depth. And after 30 compression, I will help you to give and I will teach you how to give breath. Okay. So like that you have to maintain your therapeutic conversation. Once the AED arrives, your first step is to turn it on by pressing the power button. As you know, AEDs are designed for easy use, especially for lay persons. They are manufactured, so instructions are clearly illustrated or labeled on the device. Follow the visual guide to correctly place the AED pads, like apply the pads, one just below the clavicle, and it's mentioned here right or left, and next few inches below the armpit, 6 to 8 centimeter from the armpit. And then only you have to connect the cables. After connecting the cables, you have to verbalize that you are going to analyze the rhythm, all clear. Stop compression, I'm going to analyze the rhythm, all clear. If it is a shockable rhythm, the AED will announce that it's shockable rhythm, shock advice is going to charge. The machine is going to charge. Once it's charged, again you have to verbalize that all clear. I'm going to shock in 3, 2, 1. All clear, shock. If it is a non-shockable rhythm, then continue CPR. You have to resume the CPR. And one more thing you have to, it will not happen in this scenario, but you have to keep in mind that do not place pads over the water. If excessive chest hair or any medical patches or implants, do not place it directly over that. Wipe the area dry, remove any patches, and if there is a visible implant, you have to place the pad slightly below or beside it, not directly over it. That you have to keep in mind. Once the pads are in place and cables are connected, verbalize it clearly, like analyzing the rhythm, everyone clear. Ensure that no one is touching the patients during analysis. Am I clear? Okay. Meanwhile, you will hear the sound of an approaching ambulance. The emergency response team has arrived on the scene. They will take over the situation and check for a pulse and confirm signs of life. One of the team member will ask you what happened to this patient. At this point, you must provide a clear and structured handover using ISBAR tool. So once the emergency response team arrived, they may say that I am a paramedic, I will take care of him, let me check his pulse. Oh, that's really great, I can see a signs of life. Stop compressions. Great job. And could you please update me what happened to this patient? So at this point, you must be very clear and structured handover using ISBAR tool. You have to give handover in like that way. As you all know, as we all learned, you have to identify yourself and identify the patient. If the patient is unknown, you have to say everything is unknown. And you have to brief the situations very clearly, and you have to reveal the background history, what happened, and how was the assessment, and what all recommendations you have done. Deliver the handover confidently and concisely to ensure a smooth transition of care. Let's see how can we give appropriate handover to that paramedic. Okay, I am so and so, a registered nurse. I found a person who collapsed when I entered the room. His name, age, ethnicity were unknown. I assessed his responsiveness and checked his pulse and breathing. There were no signs of life. I recommended to activate 111 and bring AED as early as possible. I delivered 1 or 2 or 3 shocks around few minutes before you arrived. Am I clear to you? Do you have any confusions or do you need any clarifications? No, thank you. If you need, I'm happy to help you further. No, thanks. That's all about our station. Station 5 Emergency Skill Assessment. I hope everything is clear for you.